my key message is that without co-production, that is citizens and professionals working together on the basis of equality and reciprocity, that means everybody has something to learn and everybody has expertise to bring to the table. If you don't have that at the heart of everything, then all prudent healthcare will become is just another medical model. And it'll mean that medical and clinicians are working more carefully and more prudently, but actually they're not engaging with people. So there's no prevention, there's no early action, there's no real engagement from the third sector. They're still going it alone, and that can't work. Interestingly, I think what people often ignore when they're talking about professionals and service users or citizens, they actually forget about frontline staff. They think about the leaders at the top who make the decisions and apply those to those at the bottom, or tell those at the bottom off if they don't get it right. But of course, staff in the NHS are citizens too, and they have parents and they use the service. And their expertise is often not being used either, because internally the NHS is not co-producing best practice. In Ely Caira, where they've been doing co-production for 2 years now, they have their own health strategy. They have about 80 community groups which are set up by the community members themselves. So even if their austerity continues, those groups will continue to operate. There are 31,000 hours of volunteering given by that community to support that community. And you go into the community, and whereas it used to be a place where there was little hope and there was a lot of antisocial behaviour and a sense of isolation, you go in now and it's absolutely vibrant. The money situation hasn't changed, it's still economically depressed, but they are people who are really looking out for each other. There's an extraordinary sense of community, and that has an impact, obviously, on well-being, on health, on confidence, on engagement, and indeed then on economic prospects for the people involved. Successful, prudent healthcare would be genuinely transformative. We would all feel a sense of ownership, not just of the NHS, but of all healthcare. So it will work not just in sort of critical and acute care and in hospitals and with GPs, but right across the social care sector, because all those things are linked up together. It would work to deal with well-being as well as with our own health. And so we would all be partners in that. We would all have something to contribute, and we would all support each other to support the NHS and to support acute care when it was needed.